Hello, my name is Monica Helms and I am the president of the Transgender American Veterans Association. Today, we will talk about discrimination transgender and transsexual veterans face in the VA medical facilities. For the longest time, transgender veterans have been aware that if they needed the VA as their primary health care, they risked being treated badly even if they spent 20 or more years serving our country. In some cases, they have been denied all services from the VA and turned away. In 2008, the Transgender American Veterans Association conducted a survey and 827 transgender and transsexual veterans participated. 29% of those who took the survey, 240 veterans, were using the VA when they took that survey. A full 10% of the sample was turned away from a VA medical facility at least once for being transgender. These are veterans who were essentially told that their service to our country meant nothing because of what they did after they were discharged. Other transgender veterans reported interpersonal discrimination from doctors, nurses, and non-medical staff members. This included using incorrect pronouns on purpose, not using the person's legal name, and referring to them in derogatory words. One trans man said in the survey, "I was told by a religious clerk that I should just go away because I was an insult to the brave, real men who are there for treatment." One male to female respondent noted, "I am asked about my genitals and my plans for SRS, regardless of whether or not it has relevance to my treatment." Many doctors and nurses were constantly singling out and stigmatizing their transgender patients. Illustrating this, one male to female respondent recounted the following experience. "A nurse pulled my partner out in the hall of the VA hospital where I was an inpatient and said, 'You know that really is a man, don't you?' Also, transgender veterans are much more likely to be denied surgeries such as hysterectomies, mastectomies, and organectomies, even if they are found to be medically necessary for the patient. Doctors continually violated their Hippocratic oath, 'Do no harm,' by denying these medically necessary surgeries and other medical services simply because the veteran was transgender. Others violated the Health Insurance Portability and Accountability Act of 1996, HIPAA, by telling other patients and non-essential personnel about the transgender veteran's transitioning status. Because of the TAVA survey in 2008, the VA began creating a draft of a new policy towards the proper treatment of transgender veterans. In the early 2009, the VA then sent this draft to various medical facilities in the VA system to have their transgender veterans review it. They didn't contact TAVA or the National Center for Transgender Equality for their opinion. However, the VA made several revisions, and in July of 2009, they told us the policy would be out soon. Months came and went, and over, the VA kept telling us that they would release the policy soon. In that time, NCTE and TAVA contacted people who worked for the VA Secretary Eric Shinseki, senators, representatives, legislative aides, and even sent a letter to President Obama. Nothing happened. After a year and a half, we received news that the policy was moving forward. When asked about when the policy would be released, a White House advisor said, "Soon." For those transgender veterans who keep facing discrimination from the VA on a daily basis, soon is not good enough. It seems odd that a president who has said over and over again that all of our veterans should receive the care they sacrificed for has decided that all didn't include transgender veterans. Here's what he said one time.
"For their service and sacrifice, warm words of thanks from a grateful nation are more than warranted, but they aren't nearly enough. We also owe our veterans the care they were promised and the benefits that they have earned. We have a sacred trust with those who wear the uniform of the United States of America. It's a commitment that begins in enlistment, and it must never end."
And then another.
"But we're forever mindful that our obligations to our troops don't end on the battlefield. Just as we have a responsibility to train and equip them when we send them into harm's way, we have a responsibility to take care of them when they come home.
And even this.
Just as we have a solemn responsibility to train and equip our troops before we send them into harm's way, we have a solemn responsibility to provide our veterans and wounded warriors with the care and benefits they've earned when they come home. That's our sacred trust with all who serve. And it doesn't end when their tour of duty does.
He mentions sacred trust and solemn responsibility. It seems that when it comes to transgender veterans, the country doesn't live up to those words. Why? Is the President thinking we're not patriotic enough to be treated respectfully by the VA? In a recent survey just released by NCTE and the National Gay and Lesbian Task Force called Injustice at Every Turn, they found that 20% of the 6,450 transgender and gender nonconforming study participants had served in the military, compared to only 10% of the general population of the U.S. Is this patriotic enough for you, Mr. President? Every day this policy sits on ice, another transgender veteran gets discriminated against or harassed at a VA medical facility. Tava has received dozens of emails over the last 20 months from frustrated transgender veterans with horror stories on how badly they have been treated by the VA. There is no excuse for this kind of treatment for any veteran, no matter what direction their lives took after they got out. If any American volunteers to protect this country and the people in it, then they deserve the best from our government. No exceptions. Let's hope the President gets this message, and he gets it soon. Thank you.